great. So yeah, I'm Irene. I work for Nottinghamshire County Council. I'm a head of service for early childhood services, and then within that I'm also the family hub lead for Nottinghamshire, also lead for child poverty and early years duties. So as I've said already, we are not experts in this at all, but I wanted just to share some of the work that we've done and some of the challenges and how we're trying to overcome them. You'll see on this slide just a snapshot of some of the tools that we've got. The first 3 bubbles on the top are all part of our Not to Help Yourself website, which I'll mention. And I know we've got reducing parental conflict people on this webinar as well. The top left is our Relationships Really Matters section, which is in Not to Help Yourself. Well worth a look if anybody wants to see it. I think the key for us is working with our partners and working with families, and I'll talk about that in the next slide, please. Thank you. Don't panic, I'm not going to go through absolutely all of this. This is just to give a flavour of some of the work we do. Apps, websites, I've mentioned briefly already, virtual groups and so on. So again, it's really useful to hear from other areas about how they're doing things, and there's always room for improvement in the work that we do. I will talk about apps in the next slide, so I'll hang fire on that one at the moment. But certainly our website, something we are quite proud of, are the websites that we've developed locally. So Not to Help Yourself is a huge partnership platform. It's very much around self-help. And it has a fantastic parents and carers zone, information around volunteering and work. It is for all ages, and I think that's actually one of the benefits, in that we know our families come in all sorts of shapes and sizes. We have grandparents, we have all sorts, so it is useful and developed with families as well. Not Alone is new, and that focuses very much on emotional health and mental health for young people, and that was only launched a few months ago, and that covers Nottingham City Council area and Nottinghamshire County Council. If you're looking for something very funky that was developed with young people, do have a look at the C Card Scheme website. Lovely images and so on. And then we've also got the 3 Health for Under 5s, Health for Kids and Health for Teens. They are managed by our healthy family teams, which are run by our community health provider, Notts Healthcare Trust. And I mean, they're fantastic. They're purchased, but they've been localised. We run our virtual groups. Interesting, we've heard a little bit about virtual groups, and I've got some fantastic comments and quotes from parents, many of which love them. We know we've managed to engage dads more, people with childcare issues more. However, we also know that lots and lots of our parents would much prefer to have face-to-face. But we also use it as well for training and for volunteers, which is great. It's actually meant that lots of our services are more accessible. But you know, we've already mentioned the challenges, so we do need a mixture of those. As with other areas, we do have online forms. We have an early help assessment form. There's a request for service form for parents to fill in for our children's centre service, and we have a professional referral form. At the moment, these are just the bottom 2 are children's centres, so they are county council. The early help assessment form is multi-agency, and that's been embedded for quite a few years now. We also have texting services and a lot more to do here, and I'm loving the work in Brent, wasn't it? So I do want to have a look at that, because there's more we can do. Again, Notts Healthcare Trust provide Chat Health and Parent Line, which are both texting services. Chat Health is for young people and Parent Line is for parents. Again, fantastic access there. People get a really quick response. As we know, there isn't always a school nurse in a school, for example, but actually young people do want health advice, so it works fantastically well. And then obviously we've got our social media platforms as well. If anybody is using TikTok, please let us know. We would love to use it in terms of videos and so on, but we're not quite sure at the moment, because we do also realise they've probably got to be fairly amusing, so we'll figure out that as we go on. Next slide, please. Okay, so I've mentioned briefly some of our apps already. The one on the left is called Notts Next Steps. That was developed as part of our Care Leaver local offer. It took probably about a year to develop, and it came from a very high level board who wanted to publish our Care Leaver offer in a range of different ways. So it is on Notts Help Yourself as well, but also this app was developed with our care leavers, and it's great. What it has meant is that there's fewer requests made to their personal advisors. They're empowered to do some of the work themselves and find out information themselves, and some still need some hand holding in using it, but that's becoming more and more established across Nottinghamshire. The next one along is My Knots app, and that's one that's developed by the County Council. If I had my way, that would be much, much broader and would include a lot more partner services on there. So there is a link on there, children and families, but actually if you link on that, it just takes you to the County Council web pages. I think we've missed a trick, if I'm honest, and that's certainly something that we need to look at, because it's a great app. It's got a lot more potential. We've got Mind of My Own, which is used especially with our looked after children. And then obviously we've got the national apps. I think our view is, let's not reinvent the wheel. There are some amazing national apps around. Let's use them, let's promote them. And if we can localise them, we will do. The Baby Buddy app, I know many of you involved in sort of early childhood and early years will know about the Baby Buddy app. It's one that we are working with in Nottinghamshire. It's a large local authority area. We've got 2 local maternity neonatal systems. We have 3 acute trusts. We have 2 different health community providers. We have 1 local authority and 7 district councils. To try and get them all together to work on this sort of initiative can be quite challenging. However, we've managed to get the support for the Baby Buddy app, and there is a working group at the moment looking at localising that. And if we're successful in our transformation fund bid, we will be able to pay for it. So a little hint there to Mitesh. Right, next one, please. Thank you. This is the last slide, you'll be pleased to know. So we've mentioned already online referral forms. I think the challenge we have is there are a range of different access points and referral forms. Some people might say we need to streamline them, but actually we can't do that without talking to our families. Some of them may want a range of different ways to access services, and that's absolutely fine. So we are going to be doing a lot more work with our partners and families around looking at those referral points. We know, for example, our families need to just be able to walk in or pick up a phone. They don't want to have to be referred into a service, and family hubs won't be a referral only service at all. The universal elements of it are absolutely important, so it's got to be easy to access. We also have the integrated case management system challenges. So the County Council uses Mosaic. Many of you may use that. Our children's centre cases are on there, youth service and so on. However, access to it is a challenge for our partners. We are looking at the moment at having a read-only access, but the way we're trying to get away with that is to just make sure that all the partners around the table where we need to discuss families, whether it's team around the family meetings, but also joint allocation meetings where we are looking at the data that's already held on the system and what information people have, so that we can allocate that family to the appropriate organisation or group. Virtual groups, I think we've mentioned enough already, really, but one of the comments that we had was very much around, it's worked very differently, but it's been easier for me to access. They've enjoyed not having to travel. However, as many positive comments we get the same amount of negative comments. So one of them was, okay, but I struggle with looking at a screen for a really long time. And I think we all understand that as professionals. But if you're a parent trying to digest information, it can be a challenge. Digital inclusion, I know, has been touched on. It's such a huge issue for us. We have some huge rural areas as well in Nottinghamshire. We do have the Better Broadband scheme, which we're trying to establish across Nottinghamshire, including those rural areas. But the other thing, and the very practical thing that we can do in family hubs and across our partner agencies, is to make sure that they have access to a laptop as they come into a building, or some sort of IT. We know that smartphones, we assume everybody's got a smartphone. Many people do, but actually have they got access to the credit and the data to be able to access the Wi-Fi? And that's certainly what we're finding from the parents we're feeding back at the moment. They might have that smartphone, but we cannot assume that they will be able to pick that up. And we know, for example, a smartphone can be extremely difficult to use if you are applying for welfare, for childcare and so on. It's much easier on a tablet or on a laptop or PC.
I'm going to stop you there, Irene. It was so good at the end, because as I've been saying, I really want us to get into the meat of digital inclusion. So I didn't want to cut you off any earlier. And I really loved what you were saying, A, about engaging dads with virtual groups, and B, you just touched on that incredibly important element of universal access to family hubs. They have to be easy to access. They're not just where you get referred to. So anyway, I better move on. We've got